It's Dr. Emer, and I'm really excited we're here today because we're on like phase 2 of sculpting my patient's face. And every time I see her, she looks younger. If you guys take a look, we did some neck contouring and it looks unbelievable. It's starting to really get chiseled. You could see this definition right here through the neck. We did some internal heating and we did some lipo. And what we're gonna do now to enhance that result, yeah, that'd be great. To enhance it.
All right, guys, let's show you what that looks like.
So that was our before and after. You can see right there. After. And there's the after. Look how phenomenal. It's still healing right in through here, a little scar tissue, but look at that shadowing. We call this sort of high depth neck contouring. So what do you need to do to enhance that in the next phase as it tightens up is do the facial contouring. And remember, with men, we do more of a squared off look. With women, especially her, she wants that slimmer, more sculpted look. So we're gonna do the heart-shaped look is what we call it. So let's start on the chin, because what I really want to do is just kind of get the idea of where I'm going to get this slimming. And so when I do the slimming sort of in this lower area, especially since she really wants her neck to look even more tight, is what we're going to do is do almost like a 3-point technique where we do a little bit more to get it to kind of come out pointier. Take a look. Look at that already. That small amount brings that forward, and look how it addresses the neck. Her desire to have a more contoured, sort of tighter neck. And so I like to do just a little bit, see how it all changes, how it looks. And what this does is this aligns her lower face with her lip so that it really makes that more tighter look. And then I just like to blend a little coming out because we don't want to make it too far further out because we want to keep her slim.
All right, so I'm going to answer some questions. Some not irrelevant to this treatment, but are good questions. Someone said for New York pop-up, how does it work if you need laser for multiple sessions? We come back every 2 to 3 months. We get you treatment there. You do need to pre-treat with your peels. So make sure you send us a DM, full name, email, and phone number so we can ship you the products you need beforehand.
Look at that now. If you guys look from the side, show them from the side. Look already the projection of the chin. And look at what it does on the angles now. It really just makes everything pop. And she said to me she does not want to be cheeky. She does not want to look bigger. So what are we going to do now? We're going to create more of that angle. And there's different ways you could do it. You could follow the bone, come up laterally, or we could give it a little bit of height because we are now making that heart-shaped look. So I want to give it just a little bit of height. We're using voluma going onto bone. And it's going to, I literally don't know a girl that doesn't like a little cheek filler laterally. Even some of the guys in West Hollywood here like it, to be honest.
Doctor.
Just depends on what they're looking for. And look, why is this great? Hold on, let me finish that, Drew, and then you can go chime in. We know everyone loves to hear from you. We know that. Drew's the most popular one on Instagram now. So what is it that we're looking for? That angle from the side. When we come to the side, her cheeks pop, and that also helps define the line a little bit.
All right, so we have some people are tuning in asking, why did you pick voluma? And someone's commenting about bruising on the chin they get. How do we avoid that?
Well, you can't avoid bruising when you use a needle, you guys. Now with cannula, you could sometimes. Like already, look at this. It already looks really good. The thing is, more as years have gone on, I tend to revert back to actually using a needle. Even though it causes a little more bruising, it's a lot easier for me to get finesse results and to really contour. And so the thing is yeah, we can use a cannula, but look at the precision that we were able to do using the needle here. And I know there's lots of videos now. I've been using cannulas since I was a young man, 15 years ago. And it was great, and you can do it for different areas like temple and cheeks and other areas to really get a nice volumization. But I find for the shadowing, which I'm doing right now, to really get her face to kind of look a little slimmer, you gotta do multiple layers, and you gotta do multiple sort of lines, and so it's very difficult to do with the cannula. You can only really kind of go through one area. So look at that already. Come to the side now. Show them that from the side. You see what I'm saying? That line, that sculpting line.
Doctor, someone else might be a doctor or injector here. They're asking, have you tried the new filler contour and what do you think?
You know, yes, we have many times, and the thing is, we have so many fillers here. I could literally be on a deserted island with Juvederm and still get an amazing result. Not saying it's my favorite filler at all. We're using Voluma here, not Ultra or Ultra Plus. But there's so many on the market. It's whose hands it's in. Contour may not be much different than anything else that's out there. Now I also want to give her a little brow lifting, and I also want to improve the temples, so we're going to go all the way on the bone. Why are we doing this? Because as you age, you lose a little bit of volume in the upper face. Everyone tends to want to make the mid face and the lower face really heavy. Let's always balance, and so we're doing what's called the ogive curve. And this is a well-known sort of blending, well-known anatomical blending is what we call it. When people look at pictures of those that have volume through this entire curve, the OGEE curve, they tend to look more beautiful. People rank them as looking more attractive.
All right.
So I'm gonna do just that little dab there, just to get that little sort of, as I said, blending. You know, on the upper part of the temple, and also on the bone and the lower part of the temple.
How come you started with the chin and then the lateral cheek, not the other way around?
Does it make a difference?
They're asking.
No, I'm asking you.
I don't think it does.
No, does it make a difference? Not really. I wanted to tighten her neck and see what it looked like and get to the point that I was at a nice balance point so that I could give that exact angle. So if you look to the side now, the angle from the center part of her chin to the cheek to the top of the ear all match. And that's called phi, or balance and beauty. You can draw a line from here to here to here, and it makes that beautiful contoured look. All right? So I was trying to do that with her because I felt like she already had a nice jawline, we already had beautiful lips, which we're gonna enhance anyways, so why not a little bit? So now what we're gonna do is just give a subtle bit on her jawline. Not too much. Again, I want her to stay looking slim, but I also want a little level of definition. Look up just a little higher. Move your chin just a little bit, yeah. And you can see here the contour. And I want her to just walk out of here feeling like so attractive from the contour she has. So I'm just doing kind of the light layers here. I don't want to make her heavy on this angle. Now you could actually go further back down here and build it out, but then she's going to look a lot wider. So I really don't want to widen her. I want to keep that contouring that we had from the jawline lipo. So see that here?
Oh, sorry.
All right, let's go to the other side. And so that looks great. And so we're gonna do the same thing here. Again, very different than we do the men, because we don't want this her to look wide, you guys. We want her to look shaped and tighter. A lot of people, there is a trend right now, I'll turn a little this way, good, for women to have a much more squared off jawline. I just find that if you're already a little rounder, it's not going to make you look that much slimmer. So, good. Turn a little this way. Wow. That's good. So now we're just fine tuning a little bit more. Again, that angle, I kind of still want to get this side for some reason. It doesn't want to go as high as the other side. So we're going to go a little more volume. Get that to raise up. Let me see the other side. Great. We're just going to do a little balancing here. Great. all about tweaks, you guys, mini micro tweaks. Now obviously it always looks a little more overdone, and some people get scared about it, some people know the process. I'm gonna use a cannula for that.
Okay.
But where I am going to use a cannula today is her under eyes. There's a reason. This area on her, show the under eye area.
We're nice, we're up close on her under eyes.
Exactly. So we have beautiful contour here now. We want a little bit there, but the thing is, smile as big as you can. We want to make sure that the tendon, I find that as years have gone on, I've been a little less under the eye directly as I have with support to the inferior ocular fat pads. So what we're going to do is we're going to use a cannula. And for those that follow that know, this is a blunt instrument, go ahead, that goes into the area with much less risk of bruising and swelling. And the thing is though, is, and you can see it's right here. Okay, take a look, there's the cannula. She doesn't have any pain, but I don't want to do too much of a volume there. Very minimal, because you don't want a puffiness to occur. So I'm going to go a little bit lower to the actual fat pad that's there and kind of blend it a little. There's a very specialized technique here. Good, and then we blend. Take a look now. Just a little, nothing crazy.
Okay.
We are using Vicross technology. You can see the one side's better than the other. Take a look. Pan it around. It's excellent. You can see the one side's already more improved than the other. Again, using the cannula to give some midfacial support. Sorry, honey. She's a trooper. She's been through everything with me, basically at this point. And take a look. It's just lightly filling right below. Safer in this area, less risk of bruising. Vascular compromise is significantly less risk. And, you know, this area tends to want to swell, so this limits it. Sometimes you need the needle and sometimes you don't. So take a look at the under eyes now. Much nicer. Now you can ice the lips.
Here you go.
My favorite part, you guys, the lip contouring. So I always tell people fish kisses on the ice pack because we gotta get her lips cold. What are they saying over there?
There are lots of comments. People are saying, please save the live.
And of course, they want to.
Is that still Voluma?
So now we're on velour, and here's the thing with her lips. They're so pretty already. You don't need a lot, but I also do want to give her a good result. So we're gonna do, we call this a pillar technique. Some people call this a Russian lip technique. On her lip, you don't need a ton in laterally. You want to keep most of this in the middle, in the midline. And you want to do very fine threads. Sorry, I gotta be nice in one more second. Okay, ice again, ice again. We want to do very fine threads. You don't need a ton to balance everything. So let's see. And we've done, I don't remember how long ago we did, but we've done this so we have a nice starting point in terms of the shape. But I do want her to have some lift. You know, some nice shaping to the Cupid's bow and just keep everything pretty. So you can see that little bit makes such a big difference. Okay, nice again. I'm going to switch in needles so I need an extra one. There it is.
You see it?
Right, right there. She's icing between to keep the swelling down. Velour is nice because it lasts a long time, like sometimes over a year, but it's soft, which is nice. same thing. We're gonna kind of grab this edge. Give it a nice shape using the pillar technique. You know, I did this technique like 10 years ago, before all the people were doing a big trend on Russian lips and stuff like that. No one really liked the volume being all in the middle. They all wanted this averted edge. Now everyone tends to want this midline and lifted look, which we have here, which you can see right now. It's a little bit more averted on the edge. Looks really good. Smile as big as you can. Perfect. Good. She's obviously swollen, and so that's the biggest issue, I feel like, with the lips, because you can't always tell exactly what they're going to look like for 2 weeks. But in velour makes a little bit of a change over the next few hours. It's actually going to soften. So what I'm going to do is give her a little bit of support around the marionette area and give more angle to the chin. And really, honestly, when you pan these lips, they look great. I think I almost don't want to do anything else. I still want to give her a little bit bigger on the bottom, because that bottom portion always should be just a little bit bigger than the top. Did I say anything there?
How long do these fillers last for her?
Well, we said that this one was about a year. The majority of these are. Perfect. Yeah, the majority will be about a year. And then we can, obviously I tell people wait 2 weeks, take a look. So now what we're gonna do, we're all finished. We're gonna do what we call an Emer reveal. So we're gonna give her the camera, you guys know what it is. Let's wipe her eye a little bit, she's tearing of joy. So we're gonna give her the camera, let her take a look at even what the sort of swelling is like. Even with swelling, I feel like she's more lifted, she has a little bit more contour, and the jawline is more defined from the side. So go ahead and show her.
Alright,
It's
here we
harder
go.
to see now. Always look at 45 degrees. So lay back, hold this up a little bit, and look like that. Okay, hold there. Hold there. Oh yeah, it looks amazing. Hey, look. Yeah, hold that. Now look. Turn a little. 45. You can see the contour through here, the more tightening through here, and my favorite, honestly, hold this with your hand a second. I want you to hold this. Yeah, you take a look. Look at your chin, and look at the side of the chin. Much more contour to make you look slim. I love your lips, obviously. They're like perfect. Brow lift, more defined in the cupid's bow. All the volumes through here. Oh, sorry, nothing through here, because I don't want you to look heavy. And then look at your eyes.
It's beautiful. Thank you.
It's just so natural, you know what I mean? And it seems like it's a lot, you guys, where, hold on, pan, you stay straight for a second, pan, just for a second. It seems like it's a ton of volume, but the thing is, it's really not. Oh my god, it looks really good from the side. Okay, now I'm gonna give this back to you so we can show it on the mirror. Here. It's not, because we're doing a lot of areas. Each area was basically a syringe. Okay, now take a look in the regular mirror.
It's beautiful.
What do you think?
I love it.
What did you want? What was your goal? Like, what did you want to achieve now?
Well, I wanted it like more, more
Angled.
exactly.
Yeah,
to be
more
able
sort of
from,
an angle.
Which
Okay.
I got it. I wanted to let my dips on like it looks, you know.
I love the lips. Yeah, just a little volume, but nothing
Yeah,
too crazy.
exactly.
And I like it when you look to the side, look at that elevation there.
Yeah.
Look at the elevation with the pillars.
It's beautiful.
And then cheeks lifted.
Mm-hmm.
So we hit every
You
point.
did exactly what I asked you. I didn't want it to be heavy here. I love it.
I love it too.
You're the best.
You're the best. So we have another successful female facial sculpting pan, and we'll follow her because she's looking great. She's obsessed with the mirror. I can't even take it away. I can't even take the mirror away. All right, you guys,
That's true.
thanks for following. And then just, yeah, chill and relax. We're going to get you cool and you're good to go.
Thank you.
You're welcome. Love it. Yeah, it looks so good. It's a wrap. It's a wrap.
Beautiful.
All right, are we